And at this time, we're going to hear from Dr. Wright again, who is going to provide us with an update on vaccine information and the needs for champions. So Dr. Wright, we'll turn it back over to you.
Thank you, Dr. Dukes, and I thank you for the opportunity to share this information. As I mentioned during the earlier presentation, this is where we are. This is where we're living, and I just want to take a few minutes here to share with you from the perspective of a healthcare delivery system some of the challenges that we're facing. Next slide, please. So I want to talk a little, just, you know, this is an ever-changing situation with the surge. So I'll just speak a little bit about where we are and how that messaging might actually facilitate the hesitancy campaign. I'll talk about the pathway to immunity, the case for vaccination, the data, the scientific reason why we must do this in order to recover. And then again, I'll wrap up talking about the need for champions. Next slide, please. So even though this slide is a little bit dated, a week dated, the point that I want to make here is that we have eclipsed a very critical milestone, and one that allows people to wrap their minds around the depth and intensity of the pandemic. If you put 1,000 people in a stadium or 1,000 people in a gymnasium, one of them will have died from COVID. That's across the country, which, by the way, has now eclipsed 400,000. So that ratio is well greater than 1 per 1,000. And in the state of Maryland, when I last looked earlier today, was at 68,000. Again, the idea that for the public, if you think about 1,000 people, or you think about the other question that I ask people is to think about how many degrees of separation any one of us has from someone who has been impacted by the pandemic. Next slide, please. So this is what our healthcare system, the Capital Region Health, has looked like over the past 8 months. You see, if you look at the left-hand side of this slide, that the blue bars represent the percentage of our census that was COVID. So you see there in early May, we peaked, and now look over to the far right where we are in January. We are at that same level of intensity in terms of hospitalizations. And this is not unique to Capital Region Health. This is what all health systems are experiencing across the county and across the state. You talk about continuity of operations, as Mr. McCarthy talked about. We are having to manage this in the face of continued trauma care, of continued chronic illness, and a lot of delayed care that has occurred earlier in the pandemic, we're now beginning to see the consequences of. And my board member Jim Eastep knows this well, as we report this information out to him and the other board members, trying to maintain that bilateral operation while dealing with the pandemic. Next slide, please. And then lastly, what's ahead? So this is a projection of the resource needs based on what we expect. The top line, the purple line, represents beds. And we've done a lot better this time around with preparing for the surge in terms of bed capacity. The ICU beds are represented there in green, and then finally ventilators at the bottom. What I will say is, and I'm sure my colleagues, healthcare leader colleagues, Christine Ray and others will attest that the challenge for the healthcare systems this time around is not as much equipment, PPE, and beds, it's staffing. It is staffing. And being able to be responsive to this surge with the appropriate number of team members is a challenge for all of our health systems. So let's pivot now to, next slide, Linda. Let's pivot now to really focus on what we're facing in the pathway to immunity. and making the case for vaccination. Next slide. So you all have heard about a number of scientific terms relative to the vaccine, S protein. I'm sure you've been asked, as I have many times, Doc, can I get the virus from the vaccine? Let me just take a moment to level set about the science of how the vaccine is developed. So here's a picture of the coronavirus itself that was genetically mapped last December. So the reason that we were able to move quickly to develop the vaccine is because early on in the pandemic, the genetic code that defines this virus was defined. And as such, there was recognition that this protein that sits on the surface of the virus, this S protein, could be reproduced and be part of the vaccine that actually is injected into our bodies to generate that immune response that is not dependent on any part of the virus. This S protein and the messenger RNA mechanism to reproduce it is what is the scientific hub of the vaccine. So when you are administered a COVID-19 vaccine, there is no part of the actual virus that is injected. Your immune system responds to basically these instructions that make it feel like the S protein is present, and then your body does the rest of the work, such that the next time that the COVID-19 enters with its S protein on its surface, your body responds, and the antibodies that you've developed destroy the vaccine before it can make you sick. So that is the scientific explanation to the frequently asked question about, can I get COVID from this virus? And this is unique to this vaccine, by the way. Previous technology around vaccine development does require a small live attenuated version of virus to be injected in order to stimulate your immune system. This is different. This is important to really level set with the public, that it is scientifically impossible for the vaccine to generate COVID-19. Next slide, please. So that said, we've heard a lot about variants. Vaccines mutate all the time. The most recent variant that's been identified, first in the UK a few weeks back, now here in the United States, and in fact here in Maryland, is expected to become the dominant strain in the United States within 2 months. And why is that? It's because that this variant is much more efficiently transmitted. So once it gets into the host, it is much more efficiently transmitted to others. So the infectivity rate, which is something that that folks on this call may be following here for the county and across the state, would rise as this variant comes into community spread. That rate of infectivity will become much more rapid. So that's what this variant is all about. And again, thus far, the vaccines, certainly the Pfizer vaccine the Pfizer company has reported that their vaccine is effective against all strains and all variants so far. Next slide, please. Okay, so the other question that I get frequently is, well, Doc, what's the alternative? And it's amazing to me. We're in a health system where 60% of our employees reside in Prince George's County. So these are folks who have been taking care of the sickest of the sick. And so when I get the question, it really has me scratching my head a little bit, because it seems to imply a bit of a disconnect or a dissonance, if you will. So the reality is, I just wanted to put it down on paper here. In the month of December, when there were 2 million vaccines administered and 21 severe reactions, no deaths. And if you do that math, that's a probability of 1 in a million severe reaction. 77 million people lost their lives. during that same period. And we're beginning to recognize the post-infectious complications of COVID as we move along. There was a young man who is a member of the University of the Florida State University basketball team who collapsed on the court. And the reason he collapsed was because he developed a myocarditis, which is a autoimmune inflammation of his heart. And his heart was not pumping efficiently and he went down. He has recovered, but this is now recognized as part of post-infectious autoimmune complications that we're beginning to see with COVID. And fully 20% of patients have not returned to their baseline after 3 months. These folks are known as long haulers. So again, as champions, this is the kind of information we need to have at our fingertips when people ask that question, well, what is the alternative? Well, the alternative is pretty clear. We've been living in the alternative for a year. Next slide, please. So how do we get to recovery, which is what our task force is all about? We can finally authentically talk about herd immunity. Herd immunity was thrown out there as a term inappropriately, prematurely, for political reasons or whatever, way too early in the pandemic. We are now at a place where we can talk about herd immunity as we vaccinate individuals. So if we just follow this image along the picture at the bottom of the slide here, when we have few people vaccinated, one person infected in red can infect a whole bunch of other people, right? There is no level of protection in the community to prevent the virus from spreading, community spread. However, as we vaccinate more and more individuals, that infected individual who is not vaccinated is able to spread to fewer people. And then to the far right there, where we need to get to is a place where there are far more people vaccinated than who are susceptible to infection. And that is really, it's a pretty simple concept, herd immunity. And we really honestly need to get to a place where we have vaccinated 65 to 70% of our population to look like that image on the far right there. Next slide. So what else does recovery look like? Well, there is speculation that if we do this right, in other words, achieve the kind of widespread vaccination that we need to, that COVID-19 will become endemic. So no longer pandemic, no longer epidemic, but will be at a constant level, baseline level in the population. And again, this was reported in Science last week, and so recovery would look like endemic. So it may, at this point, we don't know whether the COVID-19 vaccine would be something we need to do annually. This is continuing to be evaluated. However, we do know that if enough people are vaccinated and develop immunity, we can tamp this thing down so that it certainly is not at a place where we are now and potentially becomes endemic. Next slide, please. So what do we need to do to combat hesitancy? As I mentioned, 60% of our workforce lives in Prince George's County. And I will share with you that when we first rolled out the vaccine, great deal of enthusiasm. And for the first 3 weeks, we had no vacancies in terms of the appointment slots to get the vaccine. Well, that enthusiasm has waned. And we're now, next slide, please. We're now really embarking on an internal campaign. And I just want to share this one real quick, where we are. This is the national song sheet, if you will, around which the prioritization is being rolled out. Right now, we are straddling 1B and 1C. Where individuals basically 65 and older are eligible to receive the vaccine, educators and different categories of workers. This is where we are now, and rapidly moving to get to where we need to be, which is phase 3 down there at the bottom, general population, everyone. Next slide, Linda. So as I mentioned, we are really at a place where we have hit hesitancy big time. So we are embarking on an internal campaign that where we've identified internal champions. Our CEO, Nat Richardson, down there at the bottom left, our minister, our local minister, Minister Tracy, who is works for EVS and is passionate about our workforce getting vaccinated. My colleague, Dr. Trudy Hall, and you see here we're socializing this button. I'm wearing it right now on my ID badge, where we want there to be. We're not trying to shame anybody. However, we want there to be an enthusiasm around contributing to ending COVID. So we've been providing these buttons to those folks who have been vaccinated. So in terms of lessons learned that would apply to our work here in the task force, next slide. And this was undertaken by the nurses on the unit. And again, this is not mandatory, by the way. The vaccine is not mandatory, to make it clear. But they took it upon themselves to begin to post on their bulletin board on their unit which of their colleagues has been vaccinated. And this is, again, a tool, a mechanism by which we're trying to generate enthusiasm. Next slide. But what's real? I have been covering our vaccine clinic for several weeks now, and I've been talking to people about their hesitancy. And this history of transgressions is something that we have to acknowledge, we have to address, we cannot gloss it over. And it's not just a Tuskegee experiment. That's the one that perhaps people are most familiar with, where therapy was withheld, by the way. There is a misnomer or misperception that those men were injected with syphilis. In fact, they were denied penicillin. There's also the story of the immortal cells of Henry Lax, which is also in our market, involving a neighboring health institution. But these transgressions have been going on forever. There is the father of modern gynecology, J. Marion Sims, who operated without anesthesia on enslaved women. And then the story of Vivian Thomas, chronicled in the film Something the Lord Made, who was excluded of any attribution of the remarkable work that he did to develop the Blalock-Taussig shunt to correct a major congenital heart disease. So these are some of the stories that folks may or may not be aware of, but we have to acknowledge it. We cannot just gloss that over. And I have shared with my colleagues in our health system that you must have cultural humility when listening to people. You cannot and so this requires, in my view, and what I've been sharing with our colleagues, the need for peer-to-peer private conversation. I've done a ton of what do you call them, Zooms and calls. But what I have found to be most effective are these peer-to-peer private conversations. And so I just wanted to share, this contributes to folks thinking, and we have to respect where people are coming from, their lived experience, and how that contributes to hesitancy. Next slide. So what do we need to do? We need to develop champions, and indulge me a minute here as I describe what community influencers look like and where I think the task force can be extremely helpful. So we need community influence to change community norms and attitudes about moving from contemplating the possibility of being vaccinated to being vaccinated. This is done through authentic engagement with influencers and those who trust them as messengers of accurate and transparent information. So what are the characteristics of an influencer? Linda, next slide. So an influencer, popular in a community, someone who people listen to and receive information from, are able to leverage their large networks and followers via social media, et cetera, are willing to share accurate information and their personal experiences. And then finally, are willing to wear conversation starters, whether it's a button, like I just shared with you, a t-shirt. So what does a community influencer look like? Well, let me show you. Next slide, please. So that's a community influencer. So our intrepid co-chair, so she's got all the attributes, right? She's got two versions of her mask, right? She's got two versions of the mask. Yeah, she's and I'm not violating any no HIPAA violations here. Dr. Dukes and I talked about leveraging her image here, and it was interesting. I'm gonna tell on my co-chair here. Our vaccinator was so fast that Dr. Dukes in the bottom image was, is it done? I was just totally surprised that the thing was done. But I share this, and I also want to share, this is my last slide, the tagline that the county executive and the comms team have been promoting: proud to be protected, proud to be protected in Prince George's County. We need to socialize that kind of message. And we have this step and repeat sign in the hallway outside of our clinic, where I've liberally been taking pictures. And again, I'm not going to violate any HIPAA rules here, but I know that there are people on this call, I'm not going to call them out right now, who meet that criteria and can serve as champions. And I really want to uh, um, encourage our task force. The members of this task force certainly can check many of those boxes about being effective champions and really get this hesitancy campaign moving, because this is the only way to recover. That we must get to a place where we have protected our community, so that all of the elements of our task force are able, all of our recommendations are able to be realized. So that's what I want.